A very good afternoon to one and all. I'll be talking on smoke in the water, liquid tobacco use in Northeast India. I have no financial disclosures. Of all the many colorful and wonderful tribes of Northeast India are the tribes of Kuki, Mizo, and Mar. They mostly hail from in and around Mizoram and Manipur and Dima Hasao district of Assam. I hail from Kachar, so I get a lot of patients from these areas. So coming to the background, the purpose was to report toxic nutritional optic neuropathy in young patients belonging to indigenous tribal communities of Northeast India. All patients presented with diminution of vision in both eyes. A detailed medical and dietary history was taken, and all patients gave a history of tobacco use in liquid form, while 2 patients gave history of occasional smoking as well. So what is this liquid tobacco? I had seen a couple of my patients taking sips from a bottle in their hand containing this brown colored liquid. I was really intrigued. So on a little investigation, I found out that the local name is Tuibur or Hidakfu. It's a form of tobacco water mainly popular in northeast states of India, and it is part of social customs. It has got widespread cultural and social acceptance among these communities. It's almost as common as tea or coffee. And there is this misconception that tobacco causes purification, water causes purification of the tobacco, and it's safe to use. So I decided to investigate further and went to a local Mar village to find out what is going on. So the tobacco is first dried, then it is put in these earthen pots and it is put on fire. Then using a manual hand pump, the smoke is pumped into the water. And it is continued. The process is continued till it becomes saturated. Then a simple liquid, simple filtration is done, and this is the finished product. So the people were extremely generous to me. They also offered me a drink, but I had to decline it respectfully. So hydrocyanic acid and free radicals in tobacco deteriorate the mitochondrial respiratory chain of DNA. It causes modifications of mitochondrial morphology. This leads to demyelination. So we did clinical evaluation along with visual fields and OCT. All patients were started on oral vitamin B complex supplementation along with methylcobalamin for a period of 3 months. And we advised them to discontinue this liquid tobacco or tuibur. This is a typical patient, normal fundus, normal OCT, only a central scotoma on visual fields. But a month after treatment, there was a dramatic improvement and visual acuity improved to 6/9. These are a couple of other patients. So vitamin B complex supplementation has been useful in treating tobacco amblyopia, and the protective effect is believed to be due to conversion of free cyanide to cyanocobalamin. So all patients who had presented with diminution of vision had significant visual improvement improvement in visual acuity and visual field indices after treatment. Although the use of tuibur has been published before, but to the best of our knowledge from our extensive search of PubMed, Google Scholar, Science Direct, this is the first study linking the use of liquid tobacco or tuibur to toxic nutritional optic neuropathy. In summary, nutritional toxic optic neuropathy may be caused by a multitude of agents. The mainstay of treatment involves replacing the deficient nutrients and eliminating the offending agents. It is also important to consider contributory social, cultural, and dietary practices. So rock music is extremely popular in Northeast India, and I will finish my presentation with a rendition.
Thank you, Dr.
So we
Choudhury.
can have 1 or 2 questions. We have time.
We go on to the next speaker.
So we can have 1 or 2 questions. So we can take questions
If
from
you have.
no, so from the judges.
Have you done a VP in any of this patient? Because these are all toxic.
No, we don't have access to VP. We haven't done.
Because that is one of the main criteria to know that optic nerve is involved or not.
Yes.
How does it add to the knowledge? The only thing is that it's liquid. Tobacco amblyopia.
Well, we were not aware of this entity because we initially asked whether they smoke or not, and they just say that no, we don't smoke. But after we found out in our patient's hand, that's when we realized that we are dealing with something else.